Hi, my name is Hanya Yagobi.
And my name is V Tran.
We will be developing a patient case regarding hyperlipidemia.
The objective of the study is to access and identify a given patient case. Next is to support the appropriate drug therapy for hyperlipidemia patient. Lastly, we will create a monitoring and counseling plan for patients receiving atorvastatin. Chip complaint. I'm here to check up my cholesterol and blood glucose. TN is a 62-year-old Asian male who presents to the clinic to check his lab value for hyperlipidemia and diabetes. He also has a history of hypertension, glaucoma, and GERD. He states that he's doing fine with all the medication he's taking. However, last week he experienced a symptom of regurgitation and burning chest pain. He reported taking over-the-counter cimetidine, in which successfully resolved his symptoms, but he said that he experienced diarrhea during the time he took cimetidine. Past medical history include hypertension, hyperlipidemia, type 2 diabetes, glaucoma, gastroesophageal reflux disease, and no past surgical history. Family history: he has one sister who had stroke last year at age of 68. His mother died at age 72 due to congestive heart failure, and his father died at age 79 due to lung cancer. Social history: he's married, retired, and lives with his wife and a daughter. He's rarely exercises due to his indolent lifestyle. He smokes one pack per day and occasionally drinks alcohol on the weekend with friends. His diet includes hamburgers, fries, bread, steaks, and drinks soda oftenly. He consumes vegetable once a month. He has no known drug allergy. His medication include benazepril 10 mg by mouth once daily for hypertension, lovastatin 40 mg by mouth once daily for hyperlipidemia, metformin 500 mg by mouth 3 times daily for type 2 diabetes, Equotrin 81 mg by mouth once daily for cardiovascular prevention, latanoprost 0.005% 1 drop both eye once daily for glaucoma, levobunolol 0.5% 1 drop both eye twice daily for glaucoma, cimetidine 400 mg by mouth twice daily for GERD. His review of system is not available.
Patient had a physical examination 6 months ago. His height is 5 feet 7 inches. Weight is 192 pounds. His skin was warm and dry, no lesions or tumors. Head, ears, eyes, nose, and throat were all within normal limits. His thyroid gland was normal, no lymphadenopathy. Heart showed no murmurs, rubs, or gallops. Respiratory rate was normal. He had positive bowel sounds, soft belching, diarrhea, abdominal obesity, and his waist was 42 inches. His extremities showed no edema. Vitals included blood pressure 139/88, respiratory rate 18 beats per minute, heart rate was 71 beats per minute, temperature 98.6 degrees. His dilated fundus exam and slit lamp evaluations were all within normal limits. His visual acuity was 20/25 OU, and his intraocular pressures were at 18 millimeter mercuries in the right eye and 17 millimeter mercuries in the left. His lab results are from within the last 6 months. His total cholesterol is 225 milligrams per deciliter. His triglycerides is 174. LDL is 162, HDL 36, AST is 31 units per liter, ALT 27, HbA1c 7.1%. His sodium is 138, chlorine 106, BUN 13, potassium 4.4, bicarbonate 22, serum creatinine 0.8, his blood glucose is 121, his white blood cell 5.6, and hemoglobin 15, hematocrit 36, and platelet count is 327. After consulting with my partner, we've contrived the following problem list. Our patient needs additional drug therapy. He should start on a vitamin B12 supplement since metformin causes malabsorption of vitamin B12. The medication dosing regimen is not optimal. Our patient has hyperlipidemia, and the full lipid profile is not at our goal with lovastatin. The clinical significant drug-drug interaction. Our patient is on cimetidine, and cimetidine increases the serum concentration of metformin. Because of this, he has adverse drug reactions. The symptoms that he is having, such as nausea, vomiting, and diarrhea, are due to the side effects of metformin. The drug selection is not optimal. There are safer alternatives available. Cimetidine should be switched to either a proton pump inhibitor or a different H2RA. And there's more effective alternatives available. We should consider changing lovastatin for atorvastatin. It has a higher reduction of LDLs.
Our side problem is hyperlipidemia. Subjective. He presented to his family doctor for a follow-up on his hyperlipidemia and diabetes. Smoked 1 pack per day since he was 28. Past medical history is include hyperlipidemia. He's taking lovastatin 40 mg by mouth once daily. Patient denied to routine exercise and adhering to healthy diet. He also report of medication adhering to the drug regimen.
The objective evaluations include the following. The patient's height is 5 feet 7 inches. His weight is 192 pounds. The vitals include blood pressure at 139/88. Heart rate is 71 beats per minute. Respiratory rate 18. And temperature 98.6 degrees Fahrenheit. The fasting lipoprotein profile includes total cholesterol at 225 milligrams per deciliter, triglycerides 174, LDL 162, and HDL 36. The blood glucose level is 121, HbA1c is 7.1%. A dilated fundus exam and slit lamp evaluations are both within normal limits. The visual acuity is 20/25 in both eyes, and the intraocular pressure is 18 mm mercury in the right eye and 17 mm mercury in the left.
TN is a 62-year-old Asian male who presented to the clinic to check his lab value for hyperlipidemia and diabetes. He also has a history of hypertension, glaucoma, and GERD. He stated that he's doing fine with all the medication he's taking. However, last week, he experienced a symptom of regurgitation and burning chest pain. He reported taking over-the-counter cimetidine, in which successfully resolved his symptoms. But he said that he experienced diarrhea during the time he took cimetidine.
So the goals of our therapy is to decrease his cholesterol levels, initiate therapeutic lifestyle changes, and we want to prevent the risk of cardiovascular disease and prevent the manifestation of xanthelasma and retinal vein occlusion. Both of these ocular manifestations can result from uncontrolled cholesterol levels. The pharmacologic plan includes discontinuing the levastatin and starting atorvastatin at 10 milligrams by mouth once daily. The non-pharmacologic plan is to reduce and maintain a healthy weight. BMI of 18.5 to 24.9 kilograms per meter square and waist circumference of 40 inches is recommended. The initial weight loss therapy should decrease 10% of body weight from baseline. Eating a low-fat and low-sodium diet, including fruits, vegetables, and whole grains. Saturated fat less than 7% of calories, total fat 25 to 35% of total calories, total cholesterol less than 200 milligrams per day, increased soluble fiber 20 to 30 grams per day, and plant sterol 2 grams per day to enhance LDL lowering. He must increase his physical activity, exercising regularly for 40 minutes for 3 to 4 times per week of moderate aerobic activity. Smoking cessation, follow-up, referral to special program or pharmacotherapy, nicotine replacement.
There is several monitoring parameters. The first one is efficacy. So his cholesterol level should be decreased by 30 to 50% of his current lab. Next one is toxicity and adverse effect. We need to check his creatinine phosphokinase test for the symptom of myopathy pain, including tenderness, stiffness, cramping, weakness, or generalized fatigue between 4 and 12 weeks. Also need to check his LFT as baseline 6 weeks and 12 weeks after initiation of statin to prevent liver failure. Last one, we need to monitor for adverse effect of diarrhea, arthralgia, nasopharyngitis.
The third parameter is disease manifestation. Due to his current uncontrolled lipid levels, close monitoring of his anterior and posterior ocular structures is advised. Co-managing high cholesterol levels with current PCP in order to ensure normal lab results. The patient was educated on possible complications that may occur due to uncontrolled cholesterol levels and must be seen by an optometrist if any of the following ocular symptoms are experienced. 1. If he has any changes in central or peripheral vision. If he's experiencing diplopia, headaches, flashes, or floaters. And third, any changes in eye structure and/or appearance. For follow-up, you schedule another follow-up and FLP lab check in 3 months. If cholesterol level is controlled, then dilated fundus exam with optometrist is done annually. If cholesterol level is unstable, patients should return to clinic every 6 months for follow-up until cholesterol is controlled.
Patient education include the following: lifestyle modifications such as exercise, eat healthy diet, smoking cessation. If you miss a dose, take it as soon as you think about it and go back to normal time. But if it has been more than 12 hours, then you should skip the missed dose and go back to normal time. Do not take 2 doses at the same time. You should avoid grapefruit or grapefruit juice while taking atorvastatin. You should talk to your doctor or pharmacist for more information. Avoid or limit drinking alcohol because it might increase the risk of liver disease. In terms of storage, you should store atorvastatin at room temperature or keep it in a dry place. Do not store in the bathroom.
Thank you for allowing us the opportunity to work with different healthcare professionals to evaluate and improve the health of our patient.